When you first get out of bed?
It's pretty good.
Okay. So how do you get out of bed in the morning?
I have to kind of take my time.
So I thought it was pretty good. I guess it's not pretty good. I mean, if you really think about it, it's not pretty good. It's still challenging.
Yeah, it's not the way it used to be.
Okay, so when is it at its worst for you?
Like usually the end of the day.
Okay, so the end of the day, it's at its worst. You go to bed. You fall asleep easily or no?
Once I find a comfortable position.
Okay, and then you make it through the night. If you roll, you don't feel it?
Yeah.
Sometimes you feel it.
Yeah.
And then when you get out of bed, you get up gingerly.
Yeah.
Start to walk it off. It feels a little better.
Yeah.
Okay, let's have you stand up.
Okay.
Okay, turn and face. Yeah, good. You don't see me, it doesn't matter. Okay, so let's just stand there. 0 to 10. What do you feel?
Like a 3.
Okay, and where do you feel?
Like here.
Okay, so in the back, to the right.
Yeah.
Does it ever go into your butt? Ever, ever, ever?
No.
Okay, never goes down this leg, never goes here, jumps around, none of them.
No.
It's just right here on the right side.
Yeah.
Okay. Arch back towards me, as far as you go. Does that change anything? And up.
No.
So it's staying at 3 out of 10.
Mm-hmm.
Okay. Side bend to the left. Does that change anything?
Feel a little.
So am I aggravated?
Maybe.
Okay. Like what is that? 4 out of 10? 5 out of 10?
What was it when I started?
3. You're a real patient.
Yeah, like a 4.
Okay. Go to the right. Anything different?
I feel a little bit.
Same?
Yeah.
Okay. Now, tell me if this bothers you. If I do this.
No, it feels okay.
Okay. What if I do this?
A little pressure, like a 4.
So that aggravates that spot or where I'm pushing you?
Do it again. Yeah, a little bit in the spot.
Okay. Hands on the front of your legs. And I want you to bend forward whatever you can.
Okay.
And then back up. That hurt at all?
Just tight my legs.
Just your hamstrings. It didn't aggravate that at all.
Mm-mm.
Okay, I want you to do 10 of those slowly. And at each time I want you to try to go as far as you can, whatever you can, but always come back up straight.
Straight? What do you mean?
Like I don't want you doing this. 1, 2.
Okay, come up all the way.
Yeah.
Okay.
1.
With my legs straight.
Yep.
All the time.
2. Okay, that's pretty good. Is it getting worse? Staying the same? Getting better?
You feel a little here.
Up higher?
Mm-hmm.
Oh, so it's moved up.
Mm-hmm.
Is that what you're telling me?
Mm-hmm.
Okay. And
It might
stop.
be different though, because it's still there. It just
So
that's
this
gone.
this is the same.
This could have
And
been
you
a
feel
silk
something in here?
Not now,
Okay.
but while I did it.
But so that didn't aggravate this.
No.
Okay. So it's 3 out of 4?
Yeah, it's 3.
Okay, hands on your hips. Arch back towards me like that. Okay, and then back up. Okay, I want you to do 10 of those. Okay, staying the same, getting worse, staying better.
I'd say it's a 5.
Okay, so it's getting worse.
Yeah.
What'd you say? Okay, hands on mine.
Okay.
Face me.
Okay.
Stand on 1 foot, I don't care which one. Go up on your toes, and down. Whoa.
We'll pop.
Can you do that and hold it up there? And down. Okay, good. Now, partial squat. Okay, again. And again. And up. Good. Switch. Left one, go up on your toes. Down, up and hold. And down. Good. And then partial squat. Hold it. Again. I think this is. You good. And that's how I talk to patients, so it doesn't matter. And up. Okay, have a seat right here. Hands behind your back. Slouch. Any change? You don't have to lean forward
No.
unless you're weak.
No.
Okay. I want you to point your toe on the right side.
Okay.
Bring this up. Any pain?
Just stretch.
Okay, bring your foot up. Any change?
It might feel a little tight here.
Okay, but not where your pain site is.
Mm-mm.
Chin to chest and lean forward a little bit. And then back. What'd that do?
I just feel stretch here.
Okay. Now let's do the opposite side. Toe pointed, toe up, look down, bring forward a little bit, and up. Same thing? Okay. Let's have you lie on your back, 10%. Okay. Let's have you bend your knees, lift your pelvis, and down. That just sets your hips in line so that I can check. Wow, pretty impressive. Equal. Okay, keep me posted. Other than you have pants that are
Very
like
tight.
leather tight, like women wear, but and I would say that to my patient. So doesn't matter. Any pain?
No.
Probably not. I can't get up there high enough. Okay. Any problem?
No.
Any problem?
No.
Okay. Don't let me push down. You try to hold.
Yeah.
And rest. Any pain?
No.
Okay. Let's take these. Hold that there. Don't let me push. And rest. So, external rotation on this side's a little tighter. Watch. Did you know that?
No.
I would be saying this to my patient, by the way. Yeah. Because they go, oh. Any pain in the groin?
No.
Okay. This is just inquisitive. This is what I do when I'm inquisitive. Interesting. Okay. Keep me posted.
Okay.
Other than hamstring. Is that your hamstring?
Yeah.
Woo. You're equal to me. Okay. Other than your hamstring? Okay.
Just hamstring.
This hamstring. Okay, relax. Again. Bing. First try. Bing, bing. Okay, good. If I'm concerned about neurological deficits of any kind,
Just take it off.
oh, I take the shoe off. Okay, bring your foot up towards your face. Don't let me push. You try to hold. Okay, you win. Okay, this one, don't let me push. Try to hold. Okay, you win. Okay, big toe up towards your face. That's how it's slung. Don't let me pull. Good. This one, don't let me pull. Good. Okay, foot out to the side like this. Don't let me push. You try to hold. Great. This one, don't let me push. You try to hold. Good. And relax. Very good. Bend your knee. Bend your knee. This is just a symphysis pubis osteopathic, actually, mobilization technique. Don't let me pull. And where did you feel it?
In my groin.
Yeah. Well,
Was there a pop?
sometimes you're,
Pop?
if it was symphysis pubis. Okay. Knees to chest. Okay. So here we go. Any pain?
No.
Okay. So then I do 10 of these, which I'm not going to do. And the reason I'm doing them is because I want to feel the push, and I want them to push. Like I really want to push.
Okay.
You know, but I would have people put shorts on so they don't have these
Okay.
kind of pants. But anyway, so then I'd say worse or better, ask them. Then after I do that, sometimes, as you saw the other day, as I come down, they go, ow!
Yeah.
That's just throwing into extension because this is so heavy. To prove my point, I would go one leg down, and then they go, I don't have the pain, which means the weight of both of these is too heavy.
Mm-hmm.
So I'm going to have to be aware of that in my exam. If I thought this made them better, and I said, okay, I'm going to give it 10 of these every 2-3 hours. I want this leg to go down, this leg to go down. I don't want both of them to go down because they're not ready for that back there. Okay, so I do that. Then I would rotate like a McKenzie rotation and just see how that feels. Does it make it move this way, central? Does it make it move lateral? And if sometimes they'll go, oh, that hurts. And I'll say, okay, I'm gonna wait 45 seconds. And then as they relax, it goes, oh, it's decreasing. Oh, it's not, no, now it's more here.
When do you go to this? Something
Rotation?
Or
If
like,
I think it's going down the leg, and I don't think it's something that traction I need because there's no neurological deficit, then I think I might be able to move it. Just doing this, yeah, then I do that. But, like, so when you go to the McKenzie course, which is a great course to go, so he thinks if, like Cyriax, if you open the opposite side maybe that'll decrease the radicular pain, which probably more than not. I always do the 80-20 thing. But sometimes, for some strange unknown reason, you go to the pinch side and they get better. Well, then you go to the pinch side. Doesn't matter what logic. So it's all about, what do I find? Does it make sense to me? What makes the most sense? And I'm going after that against their number one thing, which is, what is it? If it's the pain, the pain is the number one thing. Exercise isn't the number one thing. The pain is the number one thing. When I control their pain, then I can maybe get them to believe in exercise. Maybe. But, so I'm always wondering, what's the number one thing? And that's all I'm thinking about. I'm thinking about their pathology, but I'm thinking about, how do I decrease their pain, prove to them that I really know a lot, and that I believe in them and they'll believe in me, and then really care about what I tell them. So that's important. Okay, let's have you roll over on your stomach, however you can. I don't really care. Yeah. Yeah. So a lot of people say, I can't lie on my stomach, it kills me, it kills me. Let me take your glasses.
Thank you.
And I go, we'll see if it kills you. And I'll put pillows under there. 5 is my most I've ever had, so I've been like that. And then the pain's left with 5 pillows. So then all I'm gonna do is have them do 5 pillows and slowly take pillows out during the night, like when they get home. That's all I'm gonna do. Okay, so now I do L3 stretch, right? I don't do it this way, which I know. I could do it that way rarely, because as soon as I lift this leg, now I'm gonna throw into the thing, SI, pelvis rotation, too many factors. I just wanna do this and see what happens.
If it's positive, what do they say?
Okay, so if this is positive, that's only one symptom or one sign. If I could throw that out, like if my exam shows nothing, then I might get back to that later, because I think it's bull. I think they're tensing up, and I don't even think it's significant.
Okay.
You know, so.
If it's true, is it usually the front of the leg, or can it sometimes?
No, they'll feel it here.
Okay.
No, they won't feel here. This is a quad.
Okay.
Yeah. Okay, don't let me push up, you try to push down. So I'm doing, you're gonna do a quad.
Got it.
Yeah. And yeah. Now with that, I do not judge grade tests on my manuals. Don't let me push down. So I might say it appears strong. There's no neurological deficit. If I questioned through my exam that they were showing me L3, then I would take a leg press, which isn't an aggressive approach, because if you have a disc and you're going to go to leg press, so when I go to leg press though, I'm not going to have to use a ton of weight, even though I'll do bilateral with a lot of weight. But then when I go to the single leg, usually it'll show up really quickly. So then I do this one, don't let me push. Yeah, don't let me pull. Now, if someone registered a hamstring, well then I would do hamstring either side, because
internal rotation. Rotation.
Yeah, exactly. Yeah.
So
if all of a sudden that happened, then I would check the hamstring in my exam, and then boop, boop, good, boop, boop, good. Yeah. So then I say, let me see you do a press up. So you're going to put your hands up, but I want you to go as high. Yeah. And then just push up, leave your waist down. Good. No, relax. Relax your butt. Yeah. And then down. I don't want them contracting their glutes. And everybody does. Most people. Go ahead. Again. Any pain? Good. So then I'd say do 10 of those. And then does that make it worse? Does that make it better? Whatever. Yeah. That's good. Yeah. So then I go. So you got L4 at the high iliac crest, right? So below that's 5. So then I'm going to slant right hand first on top, because L5 goes that way. So I might do some pressures, L4, L3. Now I'm going to switch, and then I'm just going to go L1, and then T a little bit. I might go T just a little bit. So how does that make it better or worse? I'm going to possibly just check, even though it's very common that the sulcuses are painful, doesn't mean that I think the injuries here, even when they go ow, 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 so what? But they're aware of it being spot, tender. So I might address a spot tender with them, you know, even though I'm addressing something else that I think's going on. But if I go in there and they go, ow, that's the worst, you know, oh my God, that's killing me. Well, then I'll address that spot because they think it's that.
So if you check that and it's painful, you go to the other side?
Well, no, I do both at the same time.
Oh, okay.
Yeah, like I'll do that because I don't want to do one. Because, you know, people, depending on their age, if they're older, they'll go, ow, 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 ow. Well, that's not valuable.
Yeah.
That's like, if that's the case, that's why if I think someone's overly sensitive, I'll be palpating both sides at the same time.
Okay.
Yeah, to kind of confuse them, but help them figure out what the hell is really going on.
Okay.
Because they don't always know, in my view. Yeah. You know, so if I wanted to go piriformis, check it out, you know, you can do that or have them tighten their glute. Or I could say, just lift this up, yeah, and down, and then lift that up and down. Lift this one up again. Is one heavier? And typically they'll know, because then you might have a glute piriformis issue if one's harder, you know.
Harder to lift.
Yeah, which they're shocked, you know. They're like, whoa, how come that's weak, you know? So, if I had to say basically, that's a very basic lumbar exam that goes pretty quickly.
Yeah.
Yeah, just if you know. And in the whole process, I'm thinking, did it hurt in the morning? Because if my logic, you know, it's simplistic to the patient. So I always explain how I'm going to explain to the patient. So the disc has an opportunity to absorb during the night because you have 25% pressure on it from the surrounding cells. So you're taller when you first step out of the bed in the morning. If there's a protrusion, well, that protrusion's bigger in the morning. So people are shocked how painful it is when they first get out of bed. I'm not shocked. Then they walk it off. You become your normal height. The protrusion becomes more normal. They feel this is good. I'm a lot better. No, they're not better. Because I always say the last thing to go with a protrusion or a herniated disc is the morning pain. Because that damn thing's bigger in the morning. You know, so I mean, if it's that, I'm thinking of those things when I'm going through the exam. You know, if I think repetitive flexion helps, then I'm thinking flexion and lying will help. So now I'm thinking it's dysfunction, it's an adaptive shortening of tissue. But let's say we have a derangement and we address the derangement and we're at 80%, we can't knock out the rest. Usually it's a dysfunction now. So then you start to flexion, simply flexion lying is the easiest. And then little by little, you stretch that excess tissue that adaptively shortened, and then they get the last 20%. Because which is something everyone's staying with the disc, tractioning or whatever, and they got to move on. They can't do that. Yeah. Now I might have them go up on all fours if I'm worried, but I want to get some flexion and bring this up a little more. Like, yeah. So I want this to be 90, right? This angle. So and then I'll have them rock back, keeping their hands there. But you don't have to because your pants will rip probably. And then up, yeah. And then I'll just have them do 10 of those. Say worse or better, right?
The exam?
Yeah. I'll go, is this 10 of these worse or better? Yeah. So here's, we're doing flexion, but with gravity going that way, right? So, you know, what are we trying to accomplish here? Now this is a big stickler for, if I'm gonna do in the future, I know this is getting off topic, but that's me. If I did extension, hip extension, and I'm trying to strengthen glutes or in this all fours, I'm a stickler for them keeping this 90 and keeping a stick across here. Because if they're off balance and the stick rolls off this or this, they're not doing it correctly. So or they start raising this and they come back like that. And then they raise this and they come back like that. And before they finish, they're like that, which is biomechanically incorrect. So that's just a little sidebar. But anyway, okay, that's the exam. Lumbar.